name is Nicole Jones, and I am the Director of Risk Prevention, and I'm going to let my associate introduce herself.
Good afternoon, everyone. I'm Jill Shumate, and I am our Director of State Support Coordination.
And today we're here to talk a little bit about the transition procedures. The Department of Mental Health has been working on developing an online procedure and policy manual. And the transition procedures are one of the first that we worked on for the last couple of months. So most of this will likely be a review of the current process with slight changes in role, which we'll get into later on in the presentation. But for most of you, this process itself will be essentially a review of the current practices. So let me get into what is a transition. So when we're talking about a transition, it's the process of an individual either physically moving to a new home with residential services or they're changing residential providers. And this process is divided up into 5 different phases. The first phase being provider selection, the second phase being transition planning, the third phase being move coordination, the fourth phase being the post-move follow-up, and the final phase being the transfer of the individual's record, if applicable. So who does this procedure apply to? This procedure applies to all the individuals approved for a comprehensive waiver slot who are moving into a new home with residential services or who are changing residential service providers within the community. It also includes youth who are awarded a comprehensive waiver slot that is funded through an IDA or interdivisional agreement with Children's Division.
So what's really changing today for the transition policies and procedure is the oversight of the transition calls. So formally, the risk prevention, I'm going to butcher this, consultants, were overseeing all of the transition calls. They were on the calls. This is going to be transitioned to the support coordination supervisors or SC3s, or if you have other roles, a mentor role on your agency team. With some support also from the assistant director and the regional office directors. So we're going to go ahead and get started. We have a procedure B through F for one is for each phase. As Nicole went through the 5 phases of the transition, there's a procedure for each one of those phases. And I just want to add, she added it in the chat just now. Thanks, Nicole. These are posted on the dmh.mo.gov governance page under a policy and procedure tab. And you should have also received links to these through the DD mail system if you are linked to that. Okay, I'm going to go ahead and get started with the first procedure, which is 9.4b, provider selection. So the responsibilities for this procedure, first is the sending SC, and as Nicole stated, this should be review. The sending SC will initiate the transition process. So this includes identifying the need for residential services or the need to change to a new residential provider. And that support coordinator will facilitate meetings between mutually interested parties to facilitate choice of the service provider and make sure the provider understands the individual's support needs. And they will also evaluate whether the chosen service provider site meets all of those HCBS, the home and community-based service requirements. So ensuring that it's accessible to the person based on identified needs, that it's integrated and supports full access to the community, and meets all requirements regarding an individual's rights of privacy, dignity, and respect, and then also freedom from coercion and restraint. As we talked about, this is the biggest change that you'll notice today, the responsibility of the sending support coordinator supervisor or their designee. They will be who's providing additional technical support to the support coordinators for any transitions deemed an emergency. They'll be doing the oversight on those calls, and technical support includes facilitation of emergency transition calls, doing some provider outreach if needed, helping with plan amendments, submission of emergency UR requests, and just any increased coordination with the individual's planning team. So really just there as an additional support to the support coordinator.
And then the risk prevention consultant will also be responsible for supporting the planning team during transitions that are deemed an emergency. And that support includes consulting on provider capacity for that provider to support the individual's behavioral needs, being able to offer tier 2 resources and support to those temporary providers like hospitals, jails, emergency crisis beds, things like that. And also serving as liaison between the transition team, tier 1, tier 3, behavioral health, and any other state and local resources as needed. It is the responsibility of the RPCs to connect teams with the appropriate resources. However, they're not going to be responsible for developing or implementing individualized supports. They are also responsible for managing the transitions inbox, and our administrative assistant will help us with that, as well as the consumer referral database. So let's talk about what's an emergency transition. An emergency transition is where an individual is currently in a hospital, a jail, some sort of temporary treatment center, or they're ready for discharge from a state-operated program, or they're considered homeless. And outside of those statuses, there's also the opportunity for regional office directors or assistant directors to request that an individual be considered an emergency placement, even if they don't meet those needs, after they have a chance to review it. And they'll send that referral to the transition inbox for consideration. So that'll bring us straight into the procedure itself. The first part of a transition is initiating the referral. The sending SC completes that transition referral packet and they send it to the transition inbox. The packet is composed of the consumer referral profile form, the housemate compatibility tool or survey, the individual's current ISP, and a behavior support plan if it's applicable, any amendments to the ISP or the BSP. They will also submit an authorization for disclosure if the individual is under the age of 21. And then they will also indicate in their email to the transition inbox whether that person is in an emergency transition situation. From there, the admin assistant for the risk prevention team is going to be managing our inbox. And so they will look at the referrals that come in. And if the referrals are not considered complete, so they're missing some of those required documents, they will notify the support coordinator that the packet is incomplete, why it's incomplete, and ask that they resubmit the packet. And then the sending SC will be responsible for resubmitting the packet once they've had a chance to correct the missing documents. If the consumer referral database packet is complete, what will happen is the administrative assistant will do 2 checks. One's on the Missouri Highway Patrol Sex Offender Registry. The next is on the Juvenile Sex Offender Registry if the individual's under 21. And we do this for notification and data tracking requirements. They will also then determine whether this individual is in need of an emergency transition. And if so, we'll notify the RPC leads who will then assign an RPC. And then they will publish the referral to the consumer referral database. The RPC team will also then send an email to the support coordinator once that referral has been published on the CRD. They will provide them with the referral number and whether the case was determined to be an emergency transition or not. The sending SC will then also be responsible with notifying the individual and guardian that the referral is open on the CRD. The administrative assistant will then forward any and all acceptances on the CRD from potential service providers to the sending SC. And the sending SC will then be responsible for forwarding those acceptances or information on those interested providers to the individual and the guardian. So if an individual is interested in receiving services from one of the providers who's accepted on the CRD, the sending SC will then facilitate introductory meetings between the individual, the guardian, potential housemates, and the potential new service provider. And these meetings can be in person, they can be virtual, they can be over the phone, just like it is happening today. And the purpose of that meeting is really just to try to determine whether it'll be a good fit for services and whether they would like to utilize that provider for residential services. If the individual declines to receive services from the provider participating in that introductory meeting, what will happen is that we'll go back to provider selection process, and that'll continue until we identify an acceptable provider. And the sending SC will notify the provider of the individual's decision. Once the individual has selected a new residential provider, the team will then follow Procedure 9C, which is about planning the transition.
Okay, so we've selected that provider, and now I'm going to go over 9.4C, transition planning, and the responsibilities for this. The responsibilities are the sending support coordinator is responsible for leading the transition planning process for the individual. So as I stated earlier, this is similar and what you do now. So scheduling that the pre-transition meeting, communication with the transition planning team, updating the ISP so that you prepare for the move, facilitate a site visit and visit with potential roommates, and then completing the other transition duties as outlined in the checklist for residential community living moves. The sending support coordinator or the designee will provide that technical support again in this procedure. And that technical support includes, but is not limited to, facilitation of those transition calls, again, provider outreach, completing plan amendments, submission of emergency UR requests, and then increased coordination with the individual's planning team. The sending regional office is responsible for approving and reviewing all the plans and budgets that have increases to support the individual's move to a new home, so changes or increases just as they do now. The sending and receiving CIC, the Client Information Centers, some regional offices, this is known as the medical records staff. They're the regional office staff that maintain the records. They're responsible for supporting the transition by transferring the individual's file. They ensure there's proper communication to the necessary regional office team members, and they also manage the EOC or episode of care in Seymour.
Regarding the risk prevention consultant, again, they're responsible for supporting teams when they have transitions deemed an emergency, and that support looks like providing consultation on provider capacity to be able to support that person, especially with behavioral needs, being able to offer those tier 2 resources to those temporary providers like hospitals and jails. They will also be coaching the newly selected residential provider so they can help them implement appropriate supports for the individual so they'll be successful in the new home. And those appropriate supports can look like safety crisis plans, behavior support plans, establishing behavioral, medical, or psychiatric providers as appropriate, and staff training on recommended interventions in order to increase provider capacity. We'll also connect the team with any Tier 1, Tier 3 behavioral health or local or area resources as appropriate. And they will, just a reminder, help connect teams with those resources, but they will not be responsible for developing or implementing any individualized supports for the person. So let's get into transition planning, 9C. So transition planning, just like it is today, once a provider is identified, the sending SC will notify via email the transition and transfer contact designees. That includes the sending and receiving regional office contacts, the transition transfer contact designee for the receiving TCM or regional office, and the transitions email inbox. The transition and transfer designees can be identified in our support coordination, transition, and transfer contacts brochure, which is on the website. And the notification should include electronic copies of the ISP, BSP if applicable, and a demographic page. Receiving CIC, so that's our client information centers, our medical records staff, will then notify the regional office nurse of that incoming residential move. They will also, if the person is moving into a host home, ISL service site, or a group home, they will notify the business office lead of the outgoing residential move so that they can end the standard means testing financial questionnaire. And the receiving CIC will also open a second episode of care to support the individual's transition. If the individual has been determined in need of an emergency transition, that RPC will also be providing additional support to the team, which we've gone over previously. And that's really consulting on provider capacity, identifying appropriate supports to help that individual be successful, and then connecting them to resources. If the individual is moving into residential services for the first time, an initial health risk screen and any identified health risk support plans are going to be completed as part of that ISP amendment process for initiating residential services. The designated residential RN, Hearst Rater, will facilitate the completion of the screen and any applicable health risk support plans. And the health risk screen is to be updated at least annually as a component of the ISP review process. This process also requires that the Hearst be updated throughout the ISP year when changes in status are identified that change any of those Hearst rating item scores. If the individual is moving to a new provider directly from a hospital, the sending SC will contact that hospital as soon as they can after admission to make sure or to request that they participate in any discharge planning and ensure that that receiving provider is given all written medication orders as well as training and instruction regarding any care procedures, techniques, use and monitoring of equipment, and any other elements of care. The initial transition meeting, the sending SC will schedule that. They can occur in person, virtually over the phone, just like they're done today. The sending SC should try to hold that meeting at least 2 weeks before the anticipated move date, and that's so we can make sure everything's in place for the move. The transition meeting will include the individual, the guardian, the receiving support coordinator or support coordinator supervisor, the current provider if applicable, and then the new provider. The sending and receiving nurses should also be included in the call when the person-centered planning and needs assessment, like the health risk screening tool, indicate that there's a need for a health risk support plan. And if the individual has been determined in need of an emergency transition, the sending SC supervisor or designee should offer additional technical assistance to the sending support coordinator during the transition planning phase, just to make sure that all necessary components of the transition are met. During the transition call, the sending SC will complete sections A, B, and C of the checklist, just as it's done today. And they will identify and resolve any pending action items at that meeting. The sending SC will need to set up the post-move call to occur within 15 to 30 days after the move-in date. And then they will send that checklist to the transition inbox for tracking within 10 days of that initial transition meeting. The sending SC will then arrange for the individual to complete a site visit at the new home. If an in-person site visit, isn't in the best interest of the individual, we can use pictures, videos, or any other methods to help that person get introduced into their new home. The sending SC will also document the plan for the move and an ISP amendment. If during the transition process, the individual's annual ISP is going to be due within 90 days of the move date, the sending SC is responsible for renewing the ISP. And they will make sure that the individual and guardian sign all necessary documents, including the ISP, any amendments, Medicaid waiver, provider and services choice statement, and they'll submit to the ISP amendment and budget through the regional office's utilization review process.
Okay, so we're going to move to procedure 9.4D, move coordination, and I'm going to go over the responsibilities first. So the responsibilities for move coordination are primarily the sending support coordinator. Most of this is done during that initial transition meeting, is when you're discussing the supports that need to be in place for a successful move. Now you're responsible for ensuring that those supports have been put in place and the individual is supported during that move phase and some of the follow-up during their transition. So Nicole's going to go over all of the procedure steps for this.
All right, so the procedures for the move coordination. So the sending SC and regional office will maintain responsibility for that individual and support coordination during the duration of the transition. And for the first 30 days after the move, the receiving provider will bill the sending regional office for approved services until the effective date of transfer. And then for the first 30 days after the move, event reports will be sent from the provider to the receiving regional office and support coordinator, where they will be entered into CMOR. The receiving regional office will then send a copy of the event report form to the sending SC. The sending SC must ensure that these following items are provided to the receiving provider at least 1 week before the move-in date: the current ISP, any addendums and budget and funding authorizations, the safety crisis plan, if applicable, a behavior support plan, if applicable, current physician orders, current specialized medical information, and information regarding diet and allergies. The sending SC must also ensure that no later than the day of the move, the following was received by the receiving provider: a minimum of 7-day supply of current medications, current physical, vision, and dental exams, Medicaid, Medicare, and Social Security cards, their current immunization records, adaptive equipment, their clothing and personal care items, personal property inventory, and then documentation of the guardianship and payee. Personal spending money, which has been assigned to the individual, will move with the individual. Personal spending money that's still in the provider's account will be returned to the regional office or is otherwise directed by the regional office within 30 days. The sending SC will update CMOR with the individual's new demographic information. They will be responsible to remind the sending and receiving providers to review and sign off on the personal inventory form. If the home is a new ISL service site and repairs or changes were necessary based on the initial ISL environment site review form, the sending SC is responsible for ensuring that the new ISL home passed the inspection prior to move. If repairs or changes were needed and have yet to occur, a new move date must be chosen post repairs and modification.
Okay, so the individual has moved and now we're ready for procedure 9.4E, the post-move follow-up. The responsibility again is primarily the sending support coordinator. They have already scheduled, typically during the initial transition meeting, that post-move meeting. So they're going to facilitate the post-move meeting and ensure that all the final components of the transition are complete. There's no additional supports needed, and the individual is ready for an administrative transfer. So Nicole will again go through the procedural steps.
All right, yeah, so the procedures for that post-move follow-up. So the sending SC will facilitate the post-move meeting that occurs within 15 to 30 days after the move. The post-move meeting date is typically set during that initial transition meeting as outlined in 9C, the transition planning procedure. The post-move meeting will include the sending SC, the individual, the guardian, the receiving SC, and the new provider. The sending SC will verify on the call that all pieces of the transitions have been completed by reviewing sections A through C. So any outstanding, they're going to make sure it's resolved and in place. The sending SC will also complete the final components of the transition as outlined in section D of the checklist. If any changes are needed or new outcomes and action steps are developed during the post-move meeting, the sending SC will provide an up-to-date ISP amendment to the receiving SC upon transfer. And a transfer date must be determined at the post-move meeting. The transfer must be completed within 30 days of the move. If additional service requests are needed, the transfer must still occur, and the new receiving SC will complete the request for new services through UR. The sending SC will also then send the completed checklists to the planning team, store it in the consumer file, and then also send it to the transition inbox. The admin assistant for the risk prevention team will review that checklist for completion and document its completion. The administrative assistant will then remove the individual from the CRD. The sending SC will then start the administrative file transfer process by following procedure 9F, the file transfer.
Okay, I'm going to go over the last procedure, which is 9.4F. Transition responsibilities. The sending SC is responsible for completing the transfer form, which triggers the administrative file transfer process. The sending and receiving CIC, or Client Information Centers, as I stated earlier, also known as the medical records staff at the regional offices. They're responsible for tracking all of the file transfer requests. They start and end any EOCs in Seymour, the episodes of care in Seymour, and they finalize the file transfer process for us.
All right, so the procedure for transfer. So once we've set a transfer acceptance date, the sending SC will complete the transfer form and verify that all of the items on the file audit checklist are contained within the file. The sending SC will send the transfer packet, which is the transfer form, consumer profile, housemate survey, current ISP, and any addendums to the sending and receiving contacts as outlined in the transfer contact brochure. The sending CIC will notify the sending business office of the file transfer. Within 3 days of receiving the transfer packet, the receiving support coordinator supervisor will confirm receipt of the transfer packet, provide an effective date of transfer, and name the assigned support coordinator. The sending SC will update all information in Seymour and end authorizations 1 day prior to the date of transfer. The sending CIC will end the episode of care 1 day prior to the date of transfer. The receiving CIC will open the episode of care if not already open, and the receiving SC will enter in any authorizations. The file shall be transferred by the sending regional office or sending TCM entity within 5 business days of the effective transfer date, and the transfer document should include all the documents as outlined in Directive 1.060 Appendix A. So if you have any questions, we're going to try and answer questions here today. We also have a Q&A document that we will draft and have come out. But if you think of any additional questions, you can send that to the tier2@dmh.mo.gov email inbox with the subject line transition procedure question. So for the policy, we had the procedure put out for comment. We had our webinars. This is our last one. We had one on the 12th, the 17th, and here we are today with our last one. We also have an opportunity to come and meet with the Tier 2 team at our coffee and chat on May 9th. If you have any additional questions, I will put our website in the chat box for you. That has the button on there to join that coffee and chat. It's at 9 a.m. on May 9th. We plan to go live May 15th, and as a support, we'll have new hire training for supervisors and supervisor designees to come and learn about the transition process. And that's kind of the timeline. So we're available for questions. Let me go ahead and I'm going to scroll up to the very top of the chat box. Michelle has a suggestion. If the packet sent in for the CRD is not complete, I recommend you notify the SC supervisor, at least CC the supervisor on the email to the SC. And Dana agreed with that comment as well. I appreciate that feedback. I think we try to, it kind of depends on the influx of referrals that we have coming through, because we have to dig around to make sure we find the correct supervisor for all the supervisors across the state. So we try to. I think something you might also consider is asking the SCs to make sure you're CC'd, because if you are on the original email, we reply to everyone who was on the original email. So you would get that notification that way too. And that would also help us move quick when it comes to managing that inbox. Amanda, she asked the question, does the transfer occur if all documents are not available from the sending SC? So the sending SC is responsible for getting everything done. So the amendments, any rights restrictions or things that need to happen, that all has to happen before the transfer can occur. Jill, do you have anything to add to that?
I don't, well, unless typically you discuss it during the transition meeting. So occasionally there are documents that are missing, and sometimes then it's agreed upon with the team of who will complete that or how it will work. But typically, yes, the sending SC has them done prior to the transfer.
Loretta said she came in a few minutes late. Would this guidance be for residential services or all transitions? So this is only for, this process here is for those people who are getting residential services. So people who have a comprehensive waiver or an IDA with Children's Division that are seeking residential services and are moving, does not apply to non-residential service transfers or moves that happen in the state. And yes, Dana, thank you. We appreciate that. We do know that the supervisors listed in the NC and then from there you can look up their email and human resources. Again, it just takes a lot of time to do that with the amount of referrals that we have. So we do try to, we definitely do involve them in any notifications about 30-day notices or emergency placement cases that come in, but with just the sheer volume of referrals, we don't necessarily always reply when it's an incomplete referral and look for that SC supervisor. Colleen, so her question is, we will not be following the transition process for child-specific contract situations, correct? And so the transition process is not something that is required for child-specific contracts. We would suggest using the checklist to keep kind of things straight, make sure everything happens correctly for a child-specific contract, but it's not required, and we're no longer placing them on the consumer referral database. They're to go through their residential care screening team to get placement options. No problem, Colleen.
I see a question from Jennifer of, will this transition process be amended when connection rolls out? There will be updates most likely to the process that will match the connection process. So yes, there will be some updates.
Diane, will the updated checklist be sent out soon to everyone? Do we use the one on the website? So I would say best practice is always to use the forms that are on the website. They're the most up to date. We will be updating quite a few documents on the website to reflect a couple of changes that have happened, right? So we have the Hearst on May 1st, so the checklist needs to be updated to reflect that. But then we also need to make sure that all of our previous documentations are in line with this policy moving forward. So we have plans to get those updated, and then we plan to send a DD blast to make sure people know that those updates have happened. But Yes, if you use the one on the website, you should be good to go. Any other questions or comments? So Sonia asked, why do some receiving TCMs ask for the transfer form prior to transition meeting being held? I received a response once from a TCM that said they were asking for the transfer form as it's one of the required documents for initiating a transition process according to the transition brochure. I think that's just maybe an inconsistency across the state. So the transfer form isn't needed until the end when we're ready to transfer the file, if that's applicable. But to initiate that initial transition meeting should include the ISP and all those documents when trying to set those meetings up. And it's outlined also here in this procedure, which is posted to the governance page as well. No problem. Any other questions? All right, well, I'm not going to hold anyone hostage. We appreciate you joining us on a Thursday afternoon to ask your questions and learn a little bit about the transition procedure. As we've said, this isn't really a big deviance from what current practice is, just some changing in roles for RPCs and supervisors on support areas. And we will be following up these webinars now that we've held all three of them with a Q&A document, and we'll send out a ding once that's been posted as well. So that way you guys are aware of all those questions and be able to look at it at your leisure. Other than that, thank you guys so much. I appreciate you, and hopefully you're having a wonderful weekend ahead. So
Thank you, everyone. Have a great day.